Robert F. Kennedy Jr., you're HHS Secretary. I'm here with Secretary Hegseth from the Department of Defense. And we had our big Pete Bobby challenge today. 50 pull-ups, 100 push-ups. You try to get under 5 minutes. How'd you do?
We got close. I was about 5:25. You were right behind me.
Jonathan Lemire asking the appropriate question. Why does RFK Jr., who at 70, let's admit it's jacked. We don't know if it's a Donnie Deutsch, like HGH thing, Remember when Donnie would used to wear the Baby Gap black T-shirts?
Still does, yeah.
Still does.
Summertime, yeah.
It is summertime in the Hamptons. But our question here is, and Lemire, you asked it, so answer it for us. Why does RFK work out in blue jeans?
And it's not just here. It's
everywhere.
Every time we see footage of RFK Jr. working out, he works out in jeans, which is not normal workout attire.
Get some sweat.
He's committed to it, though.
No, he does.
Look, there you go. He's doing all the things. The jeans don't seem to be holding him back. But I've never heard Willie. I've never heard him offer an explanation for this particular. We talked about sartorial diplomacy earlier.
Does he swim in blue jeans?
Let's not forget he went swimming in. Wasn't that Rock Creek Park? He went swimming in his blue jeans with his family. So that's Bobby Kennedy Jr. Defense Secretary Pete Hegseth flexing for the cameras while thanking President Trump for setting the example through his presidential physical fitness initiative, which is a good thing. Let's bring in NBC News medical contributor Dr. Vin Gupta, also with us, MSNBC contributor and fitness guru.
Yeah, that's right.
Mike Barnacle.
That's right.
Also works out in full denim.
He's got the full.
The Canadian tuxedo.
It's the urban cowboy attire that he wears. So, first of all, Doctor, let's just say, there have been a lot of things to be critical of RFK Jr. about. But that's not one of them. I mean, you look at kids in school. I remember we all grew up doing presidential fitness stuff. Yeah. And we get outside a lot more than we do now. Kids are overweight, out of shape, looking at their phones. This would be a good step, even if symbolic. I mean, it'd be a good step, wouldn't it?
Oh, 100%, Joe. I mean, I think what they're very good at is getting the message out. And in this case, getting the message out on healthy living, exercise, him doing these videos, nothing wrong with that. And I agree with you. I think we've deteriorated as a society, especially at the adolescent level in terms of activity. So absolutely. And he should be praised for this, no question.
All right, let's talk about the Make America Healthy Again push, as they're calling it. There was a leaked draft of White House health strategy documents that came out. Appears the Trump administration may not come down on the use of pesticides as hard as the health secretary initially said he wanted to. What more can you tell us?
Yeah, well, there was a push from a lot of environmental activists, a lot of people that really believed in the MAHA agenda prior to Bobby Kennedy being named HHS Secretary, to say you have to take a firmer line on pesticide use, and specifically chemicals that are in Roundup. Many of you may have that. Many of our viewers may have that at home. There's a chemical in Roundup that has gotten a lot of scrutiny as potentially being carcinogen. So we expected in this MAHA draft agenda report that was released last week that something would be said about this pesticide, that they were going to take firm action here. What did they do? They said that they were going to do more research on it, something that, frankly, has existed for the last 10 to 15 years. So research, that draft agenda, whether it was EPA and greenhouse gases, whether it was water quality, whether it was, you name it, this was light on actual specifics and really focused on just waffle words like more research. And really, when you look at it, it was more about research into vaccine safety, autism, fluoride, sort of his clarion calls. So
those are his clarion calls and things that disturb a lot of us. I keep hearing that there is a lot of people who support the MAHA agenda, even independent of the vaccine push. Are there positive things that he's talking about regarding food and pesticides, et cetera, that you actually think we should focus on?
Absolutely. I mean, Joe, you said it in the tee up here. He's using his platform and he's doing video messages from a gym. That right there, he's using his platform in a helpful way. They're talking about ultra-processed foods, but there's a gap between how they market and how they talk about something. They talk a lot about it. This draft agenda, Joe, had one mention of ultra-processed foods. And what did it say? It says, we're going to do more research into the impacts of ultra-processed foods.
But you really don't have to do more research into the impact of ultra-processed foods, do you? It's terrible for health.
No, and what activists wanted, what they expected they were going to get was a food label. They really wanted a warning on food that say this is an ultra-processed food, to make it as clear as day.
Could you give us examples of ultra-processed food?
Cereal. I hate to say it, most forms of cereal. Donuts, Frosted Flakes are probably enemy number one when it comes to ultra-processed
enemy
foods.
number one. I thought it was Putin. It's Frosted Flakes. Everything's upside down. No, so that is interesting, Willie. A lot of people talking more and more about processed food, ultra-processed food. I'm a cereal freak. I eat it all the time. That explains a lot here.
Yeah.
But we do need to get, we need to get that information out.
And that part of the agenda has been popular broadly. I think a lot of people who view as dangerous a lot of what he's saying about vaccines and mRNA vaccines in particular as dangerous say, wait, the food part we agree with. And by the way, who else agrees with it? Former First Lady Michelle Obama, who was attacked by the right for talking about this stuff for many years, and now he's adopting exactly what she said.
Right. I mean, this is an anemic draft agenda. It stops short of anything meaningful that hasn't been done over the last, say, 3 decades. And it really focused in on not upsetting anybody, because they didn't want to upset the food lobby, which is why there isn't that food warning label on ultra-processed foods. They didn't really want to go after the ag lobby, so we didn't really do anything meaningful on pesticides. What do they do? If you really distill it down, it's vaccine safety, autism research, into the root causes of autism, and fluoride. And really that exactly is what the MAHA agenda is. And it's very light on specifics otherwise.
So let's talk about this new vaccine that's being rolled out that people can use apparently right there at home. AstraZeneca launching a delivery option for its Flu Mist nasal spray, can be administered at home with a prescription for anyone between the ages of 2 and 49. Tell us more about this, Doc.
It's a pretty extraordinary moment, Willie. I would say that in this age, we're just talking about MAHA, RFK, his impacts more broadly. We've been talking about his messaging on vaccine safety, undermining vaccine confidence. This, I would say, is a tailwind for vaccine adoption. I would say this is a flu mist has existed since the swine flu epidemic, so early 2000s. And why was it developed? It was developed because you can effectively give the flu vaccine through a nasal spray, self-administered. And now what we're saying is we can actually send that home, basic instructions to mom, dad, to give to their child, to administer to themselves, 2 to 49 years of age, and it's effective. It's actually been re-engineered so it's more effective against prevailing strains. There was concerns about its efficacy early on, which is why it fell into disfavor, but that's been addressed. So now you can actually go to flumist.org and fill out a few questions and see if it's right for you, again, between 2 and 49 years of age. Pregnant women, those with immunocompromised status, probably need to have a conversation with your medical provider to make sure. But this is a big deal. Most children are needle phobic. 30% of adults are needle phobic. Most people don't want to make an appointment at a pharmacy because it's time out of your day. So imagine if we can start to do this for more and more conditions at home. Again, in this era of tailwinds on vaccine adoption, or headwinds, rather. This is a tailwind.
And available for this flu season?
This flu season, yeah.
All right, that's good news. I do note that most of us at this table are outside the top end age limit.
We've aged
it's very
out.
Sad at this point.
Lamir,
we've aged out.
Good
Lamir,
luck.
It's all you, buddy.
All right, I'll hold on for it.
NBC News medical contributor Dr. Vin Gupta. Dr. Gupta, always great to see you. Thanks for being here.